The mental health landscape in the United States continues to show deep disparities, affecting millions across age groups and states. The recent State of Mental Health in America report by Mental Health America highlights that nearly 23% of U.S. adults experienced a mental illness in the past year. These findings signal that mental health challenges are widespread and affect individuals from all walks of life. Youth are among the most affected, with 1 in 5 adolescents aged 12 to 17 reporting at least one major depressive episode. Alarmingly, over half of these young people, around 56%, did not receive any mental health support. Mental health issues often lead to even more serious concerns. For instance, nearly 13 million adults reported having serious thoughts of suicide last year, and the rate of completed suicides has hit a record high in the country. This underscores the urgency of early intervention, particularly for young people who might not yet have developed the resources or support systems to cope with severe mental health challenges. The gravity of these statistics reflects the ongoing crisis in mental health and the strain on individuals and families nationwide. However, accessing treatment remains a significant barrier. Many people face high costs or a lack of mental health providers in their area. On average, the U.S. has one mental health provider for every 340 people, with over 122 million Americans living in areas with a shortage of mental health professionals. In some states, these issues are compounded by economic or geographical limitations that make it difficult for people to receive even basic mental health services. This lack of access is especially problematic for those with severe mental health needs who might require consistent, long-term support but cannot obtain it due to financial or logistical constraints. Efforts by organizations like Mental Health America emphasize the importance of upstream prevention and early intervention. These initiatives focus on proactive measures that could help address mental health concerns before they become severe, including policies and programs that support mental health in schools, communities, and workplaces. By investing in mental health education and affordable resources, advocates hope to reduce the stigma associated with mental health care and encourage people to seek help early on. These efforts also address systemic issues, aiming to make mental health services more equitable and accessible. For example, only 27% of mental health needs are currently being met in shortage areas. In response, advocates urge states to adopt a public health approach that prioritizes mental health as essential to overall well-being. This includes expanding the mental health workforce, integrating mental health services into primary care, and improving mental health resources in under-resourced communities. In summary, the mental health crisis in America is multi-layered, impacting both individuals and the systems meant to support them. The path forward will require comprehensive, community-centered solutions that prioritize accessibility, prevention, and early intervention, ensuring that all individuals have an opportunity to recover and thrive.